Hello, my dear students and my dear nursing aspirants. Welcome back to your channel, Nursing Concepts by Raghav. So, the way that you have shown a very tremendous support for my previous videos, so that keeps motivating me to do the more videos and to discuss the more concept on the nursing. So, keep supporting me like this, so that itself make me and positive motivation in myself to do more videos, and that I think that will be helpful for your the NORCET preparation or for the upcoming competitive exam preparation. Yes, without making a much a time, so let's start the today's concept. So today in this video I am going to discuss a very basic medical procedure or the clinical procedures, so that commonly being done for all the patients when they get admitted or for some other reasons, or for even for the diagnostic purpose, maybe diagnostic or maybe treatment purpose. So every patients usually go through this clinical procedures, and most commonly and routinely being done. So hope you must understood the topic name. It is nothing but a very simple clinical procedure, that is IV cannulation. Okay, so let's start the discussion or the concept of IV cannulation. The IV stands for the intravenous cannulation. The cannulation means where we insert a cannula. Cannula is nothing but it's a very small, flexible, plastic tube. So that is being inserted into the patient vein. Okay, or to get an venous access, we insert a small tube or a small plastic cath. So that is being inserted into the vein to have an venous access for the purpose of fluid administration, or for the purpose of medication administration, and for the purpose of administration of the blood or the blood products, and even for the some diagnostic purpose also we do IV cannulation. As I told, IV stands for the intravenous. Intravenous. So intra means within, a venous means within the vein we are inserting, or we insert a small flexible tube, or that is we call it as a IV cannula. Okay, so small flexible tube itself is a IV cannula. So to have an access into the vein. So for the purpose of these things, administration of fluid, or maybe the administration of medication, or the blood and the blood product administration, and even for some diagnostic purpose also, and even to draw the blood also sometimes we do IV cannulation. So that flexible tube, or the small flexible tube, that we call it as a IV cannula. So what we call, so this is called as an IV, sorry, IV cannula. So IV cannula, it is also called as a medicath. So we can, this is also called as IV cannula. So in hospital we commonly call it as a cannulization, okay, or IV cannula insertion. So generally we use these terms in the clinicals, IV cannulation or IV or cannula insertion. See, we have a different sizes of cannula with a different color coding. Okay, so we have a different sizes which are varying between the size of the cannula may vary between the 14 to 16. So as the G stand for the gauge. Okay, so gauge means it's a diameter. So the outer diameter of the cannula, so that is what we call it as a gauge. Okay, it is measured in terms of gauge. So the different sizes of the cannula what we have, that is based on the gauge of the needle. So this 20 it is varying between the 14 to 26 with the different color codes. So we have different color codes for cannulas. See, as the size of the cannula, that is a gauge, gets smaller, so the diameter gets increases. The smaller the size and wider the cannula. Okay, so wider means the diameter. So you can, the size of the cannula is inversely proportional to the diameter of the cannula. So if the size increases, automatically the diameter size decreases. Therefore that means the 14 size, the major or the maximum size of the cannula that what we have is the 14, and the minimum size is the 26. So here suppose if you consider the 14 gauge size, so what about the diameter? Diameter is inversely proportion. So the number is smaller, so the diameter is more. So there is increased diameter of the cath or the cannula. So this is a very important, you must understand. So as the number of the or the size of the cannula gets smaller, the diameter of the cannula gets increases. Okay, so means smaller the size, bigger the cannula. So remember that general thing, smaller the size, bigger the cannula. Okay, so means the 26 gauge cannula has a very small wide, or the it is smaller or decreased diameter cannula, so especially used in the case of pediatrics. So based on the uh, that is the patient or the age of the patient, okay, then condition of the patient, we use the different sizes, different size cannula, and the purpose is also being considered when we are inserting an cannula or when we do IV cannulation. So when the patient requires, the diameter is more means where there we can do the rapid administration of the fluids or the medication or maybe the blood transfusion. So in such cases the larger gauge cannula or the larger bore cannulas are being used. So and even in the adults we commonly use the size, in the adult we commonly use 22 or 24. Okay, so 24 gauge cannula we commonly use in the general wards. So for pediatric we commonly use the 24 gauge cannula is been used for the pediatrics, and 26 gauge cannula is been used for the neonates. Okay, so means these smaller size cannulas are being used for the pediatric, and the larger cannulas are being used for the adults, and based on the purpose and based on the condition of the patient and the visibility of the vein, okay, the larger vein or the fragile veins or the smaller veins, we use the different color or the different sizes cannula based on these conditions. So let's see what are the different color codes are being given for the different sizes cannula. So before that, so let's see the parts. This is a cannula, everyone might have seen this in the clinicals. So this is a cannula, this is of 20 gauge cannula, so pink color indicates a 20 gauge. See, these are the parts of the cannula. Okay, so this is the outer catheter, so inside there is a needle for pricking. Okay, once we prick the vein, we will take out this needle. So this is an injection port. So these are the side wings where we can secure the cannula in place with an adhesive plaster. Then this is a wall, and here we have an lever lock plug, or we commonly call it as a IV cap, and this is a flush back chamber where once the needle gets into an access to the vein, we can see the backflow of the blood in this area. So that makes a confirmation that your needle is in the, or your catheter is in the vein. So this can be used for giving the injections, and this is a needle. So these are the different area different parts of the IV cannula, and we have another cannula. So this is called as a SV set. It is not being commonly used. SV set. Okay, scalp vein set. Scalp vein set. So it is also called as winged infusion set because it has an wings. Okay, so this is called as a winged infusion set also. Winged infusion set. So this is most commonly being used for drawing the blood samples either from the vein or from the arteries, and especially used in the case of pediatrics where the veins are very small. So this is being commonly used in the case of pediatrics, or a single venous access, okay, or a single puncture is required, or like only one pint of fluid administration, or only for drawing the blood samples either from the artery or from the vein. So we can go with the this winged or SV set or the scalp vein set. So, or it is also called as a butterfly set also, butterfly catheter, butterfly IV cannula. Yeah. So any name, all these names are given for this medical device, that is a SV set. So now let us see what are the different color codes are being given for a different size of a cannula. See, as I told, the size may vary between the 14 to 26. So the 14 gauge, okay, G stands for gauge. So the it is will be the orange color. So it is orange, okay, and 16 will be gray, and 17 will be white. So this is not commonly being seen in the hospitals. Then 18 gauge, this is green, and 20 is pink, then 22 is blue, 24 is yellow, and this is purple. Okay, the purple, these are the different colors for the different size of a cannula. So this, you see the size of the needle. Okay, so you see the size of the needle with the 14 gauge, how much large bore it has, or the large wider diameter it has. Okay, so just go and comparing with the other size cannulas. So to look at this last 26 gauge cannula, so it has a very small diameter. Okay, most commonly being used for the pediatrics, and for adults we commonly use, and regularly um, for adults we use the either the pink or the blue, that is 2022 gauge cannula we commonly use, and these two are for exclusively for the pediatrics. And even this yellow color is being used for the adults, where we have very small or the fragile veins, or where the venous access is quite difficult with the other gauge cannulas, where we can go with the yellow cannula. And especially these, the lower one what I have shown here, 14 to 18, so these are being commonly used in the case of emergencies, where the patient requires an rapid fluid administration, or rapid blood transfusion administration, or for the pre and post operative management. Okay, so these kind of cases we commonly use, or for any radio isotope administration, like for the diagnostic purposes, there we commonly go with this large bore size cannulas. Okay, so in the north side you may get an image based question on this color coding of the different size cannulas. Okay, definitely there is a possibility of getting this image based question on the IV cannula. So now let us see what type of, or what color or what size cannula is being used for what purposes. Okay, where we use this, the orange color. So orange color is being, that is a 14 gauge cannula. This is being the diameter, you see the diameter, it is 2.1 mm at 2.1 mm. So most this will administer the fluid at the rate of 240 ml per a minute. Okay, so means nearly 250 ml amount of fluid can be administered within a single minute. So the where the rapid transfusion is required, or the rapid fluid administration is required, or the fluid replacement is required, so in such cases we commonly use the orange color or the 14 gauge cannula. So here are the uses, like a trauma or the rapid blood transfusions, or during the surgery, so we can use the orange color. Then gray color, so this is a 16 gauge cannula, gray means, and the diameter is 1.8 mm, and it will delivers nearly 180 ml per minute. So this is also being used in the case of rapid fluid administration, or the blood transfusion, trauma, and even for the surgical cases. Then 18 gauge, so 18 gauge, it is a green color. So the diameter is 1.3 mm, and it delivers nearly about 90 ml per a minute. So it is also being used for the rapid fluid administration, then the blood transfusion. So in the clinicals we commonly use this green for the blood transfusions. So remember, for blood transfusion, so commonly used IV cannula is 14 to 18. We commonly use the 16 to 18 gauge cannula is being used for the blood transfusion. And for routine IV fluid administration and for the medication administration, we commonly use 20 to 24 gauge cannulas, okay, for the routine cases of IV fluid administration or for routine medication administration. Then coming to the pink, that is 20 gauge cannula. This is most commonly used for all the adults, where the diameter is 1.1 mm and it delivers nearly about 60 ml per minute. So most infusions are being administered through this pink cannula or the 20 gauge cannula, and even it is being used for the blood transfusion as well, and for the fluid replacement. So commonly it is being used. Then blue gauge, blue color, that is 22 gauge, where the diameter is 0.9 mm and it delivers nearly 36 ml per minute, and most commonly used in adults and in the older pediatrics and even in the older adults. And for pediatric blood transfusion also we can go with this blue cannulas. So but most preferred cannula for the blood transfusion, you remember, it is 16 to 18 gauge in the case of adults it is, okay. So we cannot use this size cannula in the case of pediatrics, where we commonly use the 24 or 22 cannula for the blood transfusion. Then coming to the 24, that is yellow color, where the diameter is 0.7 mm and it delivers nearly about 20 ml per a minute. So most commonly used in the case of neonates and pediatrics, and even in the older adults where the larger veins are not there, very fragile veins and very smaller veins. That time you can go with the yellow color in the case of adults as well. So in the pediatric for blood transfusion also we use the yellow color or the 24 gauge cannula. And the next is a 26. This is very smaller with just a diameter of 0.6 mm and it delivers nearly just 13 ml per a minute. So especially it has been used in the case of neonates, uh, for regular eye fluid administration or for the for medication administration in case of neonates. So these are the different color size with the different gauge or the different sizes of cannula with the different purpose of this cannula, okay. So you remember these are some important. And for pediatric commonly used is the 24 gauge cannula, okay, and for neonates commonly used is the 26 gauge, and for blood transfusion 16 to 18, and for routinely or generally we use 20 to 24 gauge cannula for the adults for regular usage. So this is all about the different color coding and different size cannulas. So now let us see, for fluid administration we need a medical device, so that is we call it as a IV infusion set. So this is also called as in generally we call it as a drip set. In hospital, in clinical setting we call it as a drip set. So this is an medical device that is being used to deliver the fluids or medications or the blood or the nutrients, that is a TPN, total parenteral nutrition. So to deliver into the veins through the IV cannula, so we need a medical device called as a drip set. See, we have a different drip set for the different purposes. So in that first one is a macro drip set. The macro drip set is being used for the adults, especially in the case of adults we use. So the macro stands for the larger, so means it delivers the fluid in larger drops, okay. It delivers the fluid in larger drops, so that means nearly 10, 15, 20 drops per ml, that is a large drops. These drip set delivers, if the drip set that we use, there is a macro drip set, if it delivers a 10 drops or 15 drops or 20 drops, it accounts for 1 ml. So this is we call it as a drop factor. Drop factor. So drop factor is nothing but it is the number of drops that accounts for 1 ml 1 ml of the fluid, okay. So that is being delivered from a particular IV set or the drip set. So this drop factor varies with the drip set. So here it is given 10, 15, 20. So every infusion set or the drip set has a different drop factors, okay. So for macro drip set, this is a common drop factors. So in general, or and common drop factor, we consider it as a 15 drops per minute as a drop factor, common drop factor for all the macro drip set. So this is being used to calculate the flow rate for the fluid administration. Then the second one is a micro drip set. So micro stands for the a small, so means which delivers the drops into a that is fluid into a small drops. So the drop factor of this drip set will be 60 drops per ml. So means the 60 micro drops or the smaller drops will accounts for 1 ml of the fluid. So when it delivers, or when we are using this macro drip set, when it delivers the 60 drops, so that means the 1 ml of fluid has been administered. So that is what its drop factor. So the micro drip set drop factor is, that is df of micro drip set will be a 60 micro drops per a minute. So this is also being used for the fluid, that is flow rate calculation. Then another drip set we have is the IV, that is a blood transfusion set. The blood transfusion set, in short we call it as a BT set, as the name itself indicates. So this is being used for the blood transfusion, or to administer the blood and the blood products. So this also looks similar to the drip set, but the change is the presence of the filter. So it has a filter. There is a special filter, so which filters any unwanted substances in the blood, okay, that are being filtered, and the a very pure blood is being administered to the patient using this blood transfusion set. Clots and all will be removed using this filter. Then another set we have is the volumetric set, IV set, or it is also called as a burette test. So this allows an accurate amount of the fluids, especially being used for the pediatrics when a smaller amount of fluid volumes are being administered. So in the pediatrics we commonly like 250 ml over 3 hours, 4 hours, okay, like that. So to prevent the accidental fluid rush of to the babies or to the patients, especially in the pediatrics, we commonly use this volumetric burette set, okay, to administer the smaller fluid volumes. So I will show the pictures of these all sets, that is IV sets. See here. So this is the drip set or the macro drip set. It is. So this is a macro drip set. Okay, it has a parts like it. This is a chamber, drip chamber. See here, this is a dropper. Okay, so in the case of micro drip set, there will be a nozzle. There will be a small nozzle like this. So this gives a very small drops. So that is the only difference between the micro and the macro drip set. So there is a presence of small nozzle which delivers or small micro drops. The fluid will run into a smaller drops. If it is not there, then there is a larger drops or the big drops will be there. So that is a macro drip set. That is the difference between the micro and the macro drip set. So it has a spike. Through this spike we usually attach to the, or we will prick the bottle for the attachment. Then air vent will be there. This is a chamber, drip chamber, and filter will be there, and tubing, and there is a roller clamp by which we will adjust the flow rate. And this is a latex free connector, okay, rubber, so we can use it for the giving injections as well. And there is a lever lock. This will be attached to the cannula, and this is a needle. So this is a drip set. And similarly, so this is a BT set or the blood transfusion set. Blood transfusion set. See the difference you can note is, see here in the drip chamber, so there is no filter. Okay, here we have a very small filter here, but in the blood transfusion set, so we can see the big filter over in the chamber. Okay, so this filters the clots and unwanted cells or the debris in the blood will be removed off or will be filtered through this filter. So this is a blood transfusion set. And I have told you there is one more set, that is a burette set or volumetric infusion set. This is called as volumetric infusion set. So it is being commonly used in the pediatrics where the accurate amount of the fluid need to be administered, and to avoid accidental fluid rush or high volume of fluid administration to the patients, especially in the pediatrics. Okay, so especially it is being used in the pediatrics. Okay, so means in this chamber, this is a drip chamber where we take the required amount of the fluid. Okay, so will be taken and will be delivered through this tubings. and there is a dial flow regulator. This is being commonly used to regulate the flow rate, manual adjustment. Okay, there is a dialer where there is a number will be there, so we can rotate this, and this usually will be connected to the IV tubing or the drip set, and we can adjust the flow rate by rotating this flow regulator. So this is a manual flow regulator. And so this can also be used when precised or controlled, or the when specific amount of fluid or the flow rate is to be adjusted or to be set, then we can use this dial flow regulator for the fluid administration. So next is uh, recommended guidelines for the changing the IV sets or the cannula. Okay, so that is all things we will discuss here. So first is the IV cannula. So IV cannula, once the IV cannulization is being done, how long we should keep it? So it is recommended that for every 72 to 96 hours, means for every 3 to 4 days. So for every 3 to 4 days we have to change the cannula. Okay, or we have to change the site of the cannula. We have to remove the old cannula and relocate the cannula into different areas. So or else it is recommended 3 to 4 days, or even it is earlier when there is an evidence of the phlebitis and the infiltration. So when you find in any complications like the phlebitis or the vein is get infected, or there is an inflammatory signs, or else if there is an infiltration, means where the fluid gets accumulated in the surrounding tissues, means it is going out of the vein, there you need to change the cannula. Or if any complications are being seen with the IV cannula, so there you need to change earlier, before 3 to 4 days as well. So but it is commonly being changed by 3 to 4 days. It isn't recommended a time for changing the cannula. Then drip set. So drip set is being used up to for 72 hours. Okay, so for every 72 hours, means that is for every 3 days we have to change a fresh drip set is being used. Or else if there is a visible blood or any clots are being seen in the tubings, there you need to change the IV set even within before the 72 hours of usage. And IV bottles. So IV bottles are being changed for every 24 hours. Okay, for every 24 hours, even if it is some amount of fluid is been left, that is to be discarded, and every 24 hours we have to change the with the new bottle. Then blood transfusion set. Blood transfusion set will be changed for every unit. Okay, for each blood unit we have to change the transfusion set, and it is recommended for at least for every 4 hours. For every 4 hours we need to change the set, BT set. Then for TPN, if you use the that is the drip set for TPN, and for every 24 hours we need to change the that is TPN set or the drip set. So this is all in brief about the IV cannulization and the medical devices that we commonly use for the fluid therapy or the fluid IV therapy. Okay, so we need a cannula, a drip set, other different kind of drip set, and the cannula. So that is that we have discussed in the today's session. So hope so this session was very clear and very simple topic. There is a possibility of getting an image based question, as I told, this different color size cannulas you may get as an image based question, and even you may get a when you change the cannula, so that kind of questions may come from this topic or this concept. So in the next video we will discuss the complications of IV therapy or the IV fluid therapy. Okay, so that's a very looks to be very simple topic, but most important for the point of examination, so that we will discuss in the next video. So this is all for the today's session, and so hope the today's session was very helpful, and you all understood the topic, uh, and please do subscribe and press on the bell icon, so that you will get the notification of my next videos, and share it to your friends and to the dear ones, or for the person who are preparing for those competitive exams. That will really help them a lot in their preparation journey. So come, let's walk together, so we'll find a way to success. So that's all for the today's session. Thank you. Take care and keep up the good work, and keep studying, keep working hard. Thank you.